Hey y'all, good evening. Add products to whatever that means. The fro is frowing. The fro is frowing. Hello, good evening. Hello, happy Saturday. Have y'all seen how these have been going viral? The little cheesecakes. Before I start talking about this, I'm gonna try it. I'm gonna see if it's actually good. Has anybody tried it? We about to see. Cause I love cheesecake. It looks like this. And you add the little graham crumbles in it. So let's see. Graham cracker crumbles. Let's see. See if it gets 5 stars. It's pretty good. I'm not mad at it. I would say, now if you have other options of cheesecake, I probably would still go with that option. Clacy, we're trying the viral cheesecake crumble that everybody was going out looking for. But if you have a choice of like, Cheesecake Factory or like, I don't know, your local grocery store bakery or your local bakery, I probably would still go with that. It's okay. I'm gonna eat it though. I'm definitely gonna eat it. Okay, so I got on live so we can talk about, hey, it's another nurse babe. This RN versus LPN versus hey girl, hey. And the RN versus LPN versus CNA beef. Because I've been seeing it so much on the internet, especially I'm in a few Facebook groups, Facebook nursing groups, and that's like, I would say 75% of their posts is like going at each other about one group thinks they're better than the other, and it's just a hot mess. And I don't know if this is like, is this a true beef that happens in real life, or is this internet? Is this internet beef? Because I don't experience this. And if you do, or if you have, please put it in the chat. I'm not dismissing anybody's experience, because nursing does have a culture of eating is young and being bullies. But are we really beefing like that? Are we? Yeah, I don't think so either. I think most of us are trying to go to work, do our work, clock in, do what we gotta do, and go home. Yeah, I think it's mostly internet because nobody has time to be even focused on anybody else, and especially not your title. I don't care, because at the end of the day, we all have to work together. Everybody has their role. Yes, Clacy, yes. Professional healthcare beef is a real, it's a thing, but I think the internet really hypes it up. The internet hypes it up. It's a thing. I would say though, that sometimes patients think the CNA is the RN, and the CNA does not correct it. Yeah. I see that online too, especially online. Everybody gets the title nurse just because you're wearing scrubs. As long as you're not going in the room acting as though you're the nurse, I don't care. I don't care. Side eye. Like, girl, you know better. I feel you. That's funny. Okay, let's see. But yeah, it's a team sport. There was one place I was working at. I didn't last there very long. I didn't last there very long at all because I had never done really like team nursing where you have the RN and you have the LPN that the RN is overseeing basically, and the CNA also. So it was like LPNs are not allowed to do assessments. So it was like I had to do my work, go see my patients, and then do my assessments, and then like she had her patients and she could do like give them meds and stuff. But if there was an IV, like IV start or first med going through the IV, I had to do that, and then I had to do her assessment. So I'm like, it's basically like these are my patients. So I felt like I was doing a whole lot. Where are the travel contracts? I don't know, girl, because I don't do travel anymore. But if you go to highest paid nurse, they always list in travel assignments. Highest paid nurse. That's where you can find your travel assignments. So what I really think it is, I think healthcare workers are just, they're mad in general, but they're mad at the wrong people. Like, we're not really mad at each other. We're mad at the system. We're mad about being understaffed majority of the time, burnt out. If you're in med surg, which that was my background. My background was med surg. And I always say, in a perfect world, in med surg, you would get no more than 4 patients. No more than 4. Because 4, you could really provide, like, the real in-depth, like, care to those patients because you would have the time. But the standard, usually most places is 5, but there's a lot of places med surg is getting 6, 7, 8 patients. Yeah, I'd be mad too. I'd be mad at work too. So we're not really mad at each other. We're mad at everything else and just taking it out on each other. We need each other at the end of the day. I used to travel, but not anymore. After COVID, I was done. Yes, girl. Well, let me say COVID is really what inspired me to travel, because I was like, all these people getting 10K a week. Let me do that too. Let me get on. So I did it for like a year, but after that I was done. Med-Surg, loved it. I'm not at the bedside anymore though. So you loved Med-Surg? I can't really say that I had a love-hate relationship. Love because that was my my introduction into nursing. I learned a lot. I became a confident nurse in Med-Surg. So, but it was just, Med-Surg is a lot of work. They used to say, they used to call Med-Surg the Walmart of nursing. Like, they said, ICU is like Nordstrom's or some high-end store. ICU is Nordstrom's. The ED is like Target and Target. And Med-Surg is the Walmart. Med-Surg is the Walmart nursing. Cause you about to get whatever. You got a lot of nursing home patients in there. You got psych mixed up in there. You got everything. You got everything being thrown at you. It's a mess. Yeah, I did my time. I always say that. I did my time on the floor. I'm done. I'm done with the floor. I'm a clinic nurse now. I live the soft nursing life. And I am not ashamed to say I live the soft nursing life. Anyway, at the end of the day, every role is needed and nobody is better than the other. That's just that on that. Now, I'm about to do some NCLEX questions, NCLEX practice questions. And my dog is over here chewing up my plant. My poor plant is just getting tore up. Okay, hopefully, if there's any students in the chat, or if you think you might remember some answers, some of the information from NCLEX, you can put your answer in the chat too. All right, so a nurse is caring for 4 clients. Which client should the nurse assess first? A client with heart failure who reports needing an extra pillow to sleep. B, a client 8 hours post-op with a pain rating of 8 out of 10. C, a client with COPD whose oxygen saturation dropped from 92% to 88% on 2 liters nasal cannula. Or D, a client with diabetes who has a blood glucose of 68 and is awake. So your answer is C, a client with COPD whose oxygen saturation dropped from 92 to 88. The rationale is this is the highest priority because it involves airway and breathing. We have to remember our ABCs. A drop in oxygen saturation in a client with COPD may indicate worsening respiratory status the client with hypoglycemia is important, but a blood glucose of 68 in an awake client is typically treated quickly and is not more urgent than compromised oxygenation. Good job, aging nurse Higgins. Nurse Bay, you got the next one. You'll get the next one. All right, the nurse is reviewing morning laboratory results for a client receiving digoxin. Which findings should be reported to the provider before administration? Oops. Hold on, y'all. Sorry, I did something to my TikTok. Okay. The nurse is reviewing morning laboratory results for a client receiving digoxin. Which findings should be reported to the provider before administration? A, potassium of 3. B, calcium of 9.2. C, magnesium is 2. D, sodium is 138. A, potassium of 3. B, calcium 9.2. C, magnesium 2. D, sodium 138. Okay, your answer is A, a potassium of 3. The rationale is hypokalemia increases the risk of digoxin toxicity. Digoxin and potassium compete at the sodium-potassium ATP pump. When potassium is low, digoxin binds more easily and toxicity becomes more likely. The nurse should hold medication and notify the provider. So, FYI, labs, yes, are hard to memorize, and you won't need to really memorize all of them, but potassium is one of those labs that you're gonna see over and over and over and over. So you need to know the potassium levels that are within normal limits. And normal potassium is 3.5 to 5. Let me look up the labs 1 second. I had this huge nursing school study guide made. Let me find the labs. Give me a second. So, where's potassium? So here, your BMP panel, most of these you're gonna have to just memorize. Like sodium, the normal parameters are 135 to 145. Potassium, 3.5 to 5. That one maybe you don't see that often. But, well, no, bun and creatinine, yes you do, I'm sorry. Bun and creatinine you're gonna see a lot. So, yeah, some of these you're just gonna have to memorize. All right, next question. A client receiving a blood transfusion develops chills, low back pain, and dyspnea. What is the nurse's first action? A, administer acetaminophen. B, stop the transfusion. C, slow the infusion rate. Or D, notify the provider. The correct answer is B. You're going to stop the transfusion. Rationale: these findings suggest a transfusion reaction. The first action is to stop the transfusion immediately to prevent further infusion of incompatible blood. Then maintain IV access with a normal saline using new tubing and notify the provider and blood bank. Okay, a nurse is caring for, oh yep, Agent Nurse Hagen, you getting all the answers tonight. A nurse is caring for a client taking warfarin. Which statement by the client requires further teaching? A, I will use a soft bristled toothbrush. B, I should keep my intake of green leafy vegetables consistent. C, I can take ibuprofen if I get a headache. Or D, I need regular INR monitoring. So, a nurse is caring for a client taking warfarin. Which statement by the client requires further teaching? That means the patient said something wrong. So A, I will use a soft bristled toothbrush. B, I should keep my intake of green leafy vegetables consistent. C, I can take ibuprofen if I get a headache. Or D, I need regular INR monitoring. Your correct answer is C. I can take ibuprofen if I get a headache. Ibuprofen increases the risk of bleeding, especially when combined with warfarin. NSAIDs can also irritate the GI tract and impair platelet function. The other statements are correct. Okay, the nurse is caring for a client with SIADH. Which assessment finding is most concerning? A, urine specific gravity of 1.032. B, weight gain of 2 pounds in 24 hours. C, serum sodium of 118. Or D, decreased urine output. Well, first of all, let's find out what is SIADH. Because if you don't know that, then you can't answer the question. SIADH is syndrome of inappropriate antidiuretic hormone secretion, a condition where the body produces excess ADH, causing water retention, dilute blood, and low sodium. So the question is, the nurse is caring for a client with SIADH. Which assessment finding is most concerning? A, urine specific gravity of 1.032. B, weight gain of 2 pounds in 24 hours. C, serum sodium of 118. Or D, decreased urine output. Your correct answer is C, serum sodium of 118. The rationale: a sodium of 118 indicates severe hyponatremia and places the client at high risk for seizures, cerebral edema, and altered mental status. While the other findings are expected with SIADH, This lab value is the most dangerous. Now, if I was a student and I was answering this question on a test, I would have chosen C just because sodium is one of those lab values that I would have memorized. And so I would know 118 is way off. So if you don't, if all of them, if you don't know, basically you're like guessing, you gotta just go with your most educated guess. Okay, the nurse is caring for a post-operative client who received morphine IV 30 minutes ago. Which finding requires immediate action? A, respiratory rate of 8. B, pain 6 out of 10. C, blood pressure 144/86. Or D, nausea. Your answer is A, respiratory rate of 8. Rationale: a respiratory rate of 8 indicates opioid-induced respiratory depression, which is life-threatening. The nurse should assess further, stimulate the client, support breathing, and prepare to administer naloxone, which is Narcan, per protocol or provider order. And if you were unsure if a respiratory of 8 is within normal parameters, you can just look at the other answers and know that those are not serious. Like, you don't, there's nothing that you need to do about any of those other ones quickly. So, all right, which task is appropriate for the nurse to delegate to an experienced UAP, which is unlicensed assisted personnel? So your CNAs, your PCAs, PCTs. Oh, my phone's about to die. Which task is appropriate for the nurse to delegate to an experienced UAP? A, teach a client with asthma how to use a peak flow meter. B, assess pain after analgesic administration. C, obtain vital signs for a stable client before discharge. Or D, evaluate the effectiveness of a blood pressure medication. Okay, y'all think about that. Let me go get my charger. I need my charger. Sorry, I'm having to share my charger with my son because he breaks every charger I buy.
Stop lying.
Ain't nobody lying. You gone through about 15 chargers. Don't make no sense. Okay, yes, the answer is C. Obtain vital signs for a stable client before discharge. Okay, now let me figure out how I can set this up. Let me come, oop, oop. Okay, hold on. I'm giving y'all whiplash, I know, I'm sorry. I wasn't expecting my phone to start dying. All right. I'm good now. Okay. Okay. All right. So the rationale. The UAP can perform routine, non-invasive tasks such as obtaining vital signs on a stable client. Teaching, assessment, and evaluation remain the nurse's responsibility. Okay. Okay. A client with type 1 diabetes is admitted with diabetic ketoacidosis. Which finding should the nurse expect? A. Bradycardia and shallow respirations. B. Metabolic alkalosis and weight gain. C. Small respirations and fruity breath. D. Hypoglycemia and diaphoresis. Okay, the answer is C. Small respirations and fruity breath. Classic signs of DKA, which is diabetic ketoacidosis, include small respirations, fruity acetone breath, dehydration, hyperglycemia, and metabolic acidosis. The other options are inconsistent with DKA. Okay, a nurse is caring for a client prescribed furosemide. Which assessment finding suggests the medication is effective? A nurse is caring for a client prescribed furosemide. Which assessment finding suggests the medication is effective? A, bounding peripheral pulses. B, decreased crackles in the lungs. C, increased jugular venous distension. Or D, blood glucose of 128. Ooh, it's starting to rain outside. Instagram is being a party pooper. It's telling me I can't have my music playing in the background. Hold on, let me pause my music before they kick me off. All right, I feel like I need to repeat. A nurse is caring for a client prescribed furosemide. Which assessment finding suggests the medication is effective? A, bounding peripheral pulses. B, decreased crackles in the lungs. C, increased jugular venous distension. Or D, blood glucose of 128. And your answer is B. Good job, Alicia. You was right. B, the rationale is furosemide is a loop diuretic used to reduce fluid overload. Decreased crackles indicate improved pulmonary congestion. got kicked off of Instagram. I have no idea what just happened. Let me get my Instagram back on. Can't you see? I'm trying to wait before I start. You know what? I'll just save my live from TikTok. Okay, let me go back. Instagram didn't like me playing music in the background. Hopefully they come. Somebody, the ones that were on answering questions come back. Sorry to the people that were on here. I got kicked off. Instagram kicked me off. Okay, let's get back to our practice questions. NCLEX practice questions. Feel free to put your answers in the chat. Don't feel embarrassed. And there's not one person that's going to get every single answer right. All right, so a nurse is preparing to administer insulin, Lispro, and insulin glargine. Which action is correct? A, mix both insulins in one syringe. Was that an accident? It probably was an accident. A, mix both insulins in one syringe. B, administer Lispro 1 hour before meals. C, hold glargine if the client is NPO. Or D, administer Lispro with meals and do not mix glargine. Your correct answer is D. Administer Lispro with meals and do not mix glargine. The rationale is Lispro is rapid acting and should be given when food is available or just before meals. Glargine is long acting and should not be mixed with other insulins. Holding glargine simply because the client is NPO is not routinely correct without further provider guidance. Okay, so the next question, a client with a chest tube suddenly develops dyspnea. And the nurse notes the chest tube has become disconnected from the drainage system. What should the nurse do first? A, clamp the chest tube. B, place the end of the tube in sterile water. C, notify the provider. Or D, apply petroleum gauze at the insertion site. Your correct answer is B. Place the end of the tube in sterile water. The rationale: if the tubing disconnects, the nurse should place the end of the chest tube in sterile water to create a temporary water seal and prevent air from entering the pleural space. Clamping can lead to tension, pneumothorax, and is generally avoided unless specifically indicated. And yes, you are going to notify the provider at some point, but that's definitely not what you should do first. Okay. A nurse is assessing a client receiving heparin infusion. Which lab value is most important for the nurse to monitor? A nurse is assessing a client receiving heparin infusion. Which lab value is most important for the nurse to monitor? A, INR, B, platelet count, C, hemoglobin A1C, or D, WBC count. Your answer is B, platelet count. Platelet count. The rationale is that although APTT is the classic lab used to titrate heparin, from these options, the most important is platelet, because the nurse must watch for heparin-induced thrombocytopenia, a serious immune-mediated complication. INR is primarily used for warfarin. Okay. A client with meningitis becomes increasingly restless and confused. What is the nurse's priority action? A, reorient the client. B, lower the head of the bed. C, decrease environmental stimuli and assess neurologic status. Or D, offer oral fluids. Okay, your correct answer is C, decrease environmental stimuli and assess neurologic status. The rationale is restlessness and confusion may indicate increased intracranial pressure or worsening neurologic status. The nurse should reduce stimuli and perform a focused neural assessment immediately. Lowering the head of the bed can worsen ICP. Okay, a nurse is caring for a client who takes lisinopril. Which findings should the nurse report immediately? A, dry cough. B, potassium of 5.9. C, blood pressure of 108/68. Or D, creatinine of 1.1. Your correct answer is B, potassium of 5.9. Rationale is ACE inhibitors like lisinopril can cause hyperkalemia, which can lead to dangerous cardiac dysrhythmias. A dry cough is a known side effect, but is not more urgent than a potassium of 5.9. Okay. A nurse is caring for a client with a suspected stroke whose symptoms began 45 minutes ago. Which prescription should the nurse question? Which prescription should the nurse question? A. Obtain a non-contrast CT scan. B. Start 2 large bore IV lines. C. Administer aspirin immediately. Or D. Check blood glucose. Your answer is C. Administer aspirin immediately. The rationale is aspirin should not be given until hemorrhagic stroke has been ruled out by imaging. CT scan, IV access, and checking blood glucose are appropriate early actions. Next question. A client receiving vancomycin reports ringing in the ears. What should the nurse do? A. Document the finding as expected. B. Hold the medication and notify the provider. C. Administer the next dose more slowly. Or D. Encourage increased fluids only. The correct answer is B. Hold the medication and notify the provider. The rationale is tinnitus may indicate ototoxicity, a serious adverse effect associated with vancomycin. The nurse should hold the medication and notify the provider. Monitoring trough levels and renal function is also important. My son is on my live. Okay. Which client is at greatest risk for developing acute kidney injury? Which client is at greatest risk for developing acute kidney injury? A. A client with a history of seasonal allergies. B. A client receiving IV contrast with dehydration. C. A client taking oral iron supplements. Or D. A client with controlled hypothyroidism. Correct answer is B. A client receiving IV contrast with dehydration. The rationale is IV contrast can be nephrotoxic. Nephro is associated with kidney, especially in a dehydrated client. This combination significantly increases the risk for acute kidney injury. Okay, a nurse is caring for a client with a nasogastric tube connected to suction who is receiving potassium chloride IV. Which finding indicates the client may be developing an electrolyte imbalance requiring immediate intervention? A. Muscle weakness and irregular pulse. B. Hyperactive bowel sounds. C. Increased appetite. Or D. Warm flushed skin. Your correct answer is A. I would say if I was a student reading this question, to me the answer would be obviously A, especially if we're asking what requires immediate intervention. Nothing is serious other than irregular pulse. Like obviously that needs immediate intervention. Rationale, NG suction can cause loss of electrolytes, especially potassium. Muscle weakness and an irregular pulse are classic signs of hypokalemia, which is dangerous because it can cause life-threatening dysrhythmias. Okay, a nurse is assessing a client by a nurse is assessing a client taking phenytoin, phenytoin for seizure disorder. Which statement by the client indicates a need for further teaching? So they said something wrong. A, I will avoid stopping this medication abruptly. B, I should use a soft toothbrush and see my dentist regularly. C, if I miss one dose, I will double the next dose. Or D, I should report rash or unusual bruising. Your correct answer is C. If I miss one dose, I will double the next dose. The rationale, clients should not take double doses of this medication. Doing so can increase toxicity risk. Good oral hygiene is important because this medication can cause gingival hyperplasia. Abrupt discontinuation may precipitate seizures. Ooh, it's coming down outside. I don't know if y'all can hear the rain. All right. A nurse is caring for a client with sepsis. Which finding requires the most immediate intervention? A, temperature 101.8. B, lactate 4.2. C, white blood cell count of 17,000. Or D, heart rate of 112. Your answer is B, lactate of 4.2. Rationale, an elevated lactate of 4.2 suggests Ooh. It made you jump? Okay, where was I? An elevated lactate of 4.2 suggests significant tissue hypoperfusion and is associated with worsening sepsis and possible septic shock. This is a critical finding that requires urgent intervention, including fluid resuscitation and aggressive treatment. So lactic acid is one of the key labs that is used to indicate whether a patient has sepsis or not. So just remember, lactic acid is associated with sepsis. Ooh, these last couple are the dreaded select all that apply. Select all that apply questions. There's only two. We'll do two. Select all that apply. Nobody likes these. You know what? Let me put my school, ooh. Hold on. The lights might go out because they always go out. Let me put my community in the chat because if you want to do more questions like these, I tutor, I do these practice questions. I talk about nursing related things in the community. So the link to the community is in the chat. You can join it. It is free. It is free. It is free. Okay. All right. Select all that apply. Select all that apply. Which interventions are appropriate when caring for a client at risk for aspiration? Select all that apply. Which interventions are appropriate when caring for a client at risk for aspiration? A, keep suction equipment available. B, place the client flat after meals. C, elevate the head of the bed during feeding. D, verify tube placement before feedings. And E, encourage fast eating to reduce fatigue. TikTok told me my live is gonna end in 5 minutes, so I got 5 more minutes with y'all. All right. Your answers are A, keep suction equipment available. C, elevate the head of bed during feeding. And D, verify tube placement before feedings. Rationale: aspiration precautions include elevating the head of the bed, keeping suction available, and verifying tube placement before feedings. Lying flat after meals and encouraging fast eating both increase aspiration risk. So, obviously, we do not want to do that. And one more. We got one more. The nurse is caring for a client receiving spironolactone. Spironolactone. Which findings should the nurse report to the provider? Select all that apply. Which findings should the nurse report to the doctor? A, potassium of 5.8. B, muscle weakness. C, blood pressure of 118/72. D, irregular heartbeat. Or E, increased urine output. Okay, your correct answers are A, potassium of 5.8, B, muscle weakness, and D, irregular heartbeat. Your rationale: spironolactone is a potassium-sparing diuretic. So the major concern is hyperkalemia. Signs include elevated potassium, muscle weakness, and irregular heartbeat. Increased urine output is generally expected. Okay. All right, so let me get off before TikTok kicks me off. Instagram already kicked me off and made me turn off my music too, so all the social medias are being party poopers tonight. But I will be back on live tomorrow. You guys have a happy Saturday. Stay dry. I don't know where you are, if it's raining where you are, but it's raining where I'm at. So